Society, more than 64,000 people will be diagnosed with pancreatic cancer. Of those, about 50,000 will die from the disease. This cancer accounts for about 3% of all cancers in the U.S. and about 7% of all cancer deaths, with more men than women getting this disease. Well, here to talk to us more about the advancements that are being made when it comes to treating pancreatic cancer is Dr. Shanel Bagwandeen. He is with Jupiter Medical Center. So thank you so much for being here with us. So first, we're talking about the advancements we're talking about this morning is a vaccine that they're currently testing. Tell us about that.
Correct. So it's an mRNA vaccine and specific to pancreas cancer. This was a study that was recently done and published last month that looks at utilizing an mRNA vaccine to treat pancreatic cancer, which is in itself sort of groundbreaking because we've learned recently about mRNA vaccines with COVID, but this has been looked at over the last 15 to 20 years with cancers, and this is the first time it's been done as a phase 1 clinical trial. And what that means, it's a proof of concept study. So they're looking primarily at feasibility as well as safety. But there were some remarkable findings in that study that would allow it to then move forward in further phases of clinical trial. So to highlight some of the key pertinent things, especially with regards to the mRNA vaccine, is that there were 16 patients enrolled in the study. They were very early, presumably early pancreatic cancers, and about 50% of those patients did not demonstrate relapse of their disease after the 18-month study.
Because that's something we see in common with pancreatic cancer is that it gets treated, but then it kind of comes back quickly.
The disease does have the propensity to recur, and the majority of patients ultimately die as a result of their disease. So in terms of 5-year survival, we typically quote about a 12% 5-year survival with this disease. But the majority of patients do succumb to their disease. They do have recurrence. And as you mentioned, 7% in terms of the overall cancer death is what that translates to is that pancreatic cancer being the 3rd most deadliest cancer right now and on track to become the 2nd most deadliest cancer by 2025. Wow. So there does need to be a push in that direction to touch as many patients' lives as we can.
And we should mention that mRNA vaccine, that's the one that BioNTech created for COVID. That's
Correct.
What was used for the COVID-19 vaccine. Why is pancreatic cancer so difficult to treat?
Yeah, this is an aggressive cancer. Usually when it presents, especially because of how it can hide within the pancreas, this cancer usually will present with metastases, which means spread away from the pancreas. A lot of the patients that I see and treat as a surgeon, oftentimes, and about 80% of the time, you don't typically have the opportunity to treat them with surgery, which is the best opportunity for cure. A vaccine wouldn't necessarily take away from that. In fact, this study was done specifically on patients that had surgery, and after that, the design, manufacturing, et cetera, for that vaccine was tailored specifically to each individual patient so that they could receive a vaccine that was specific to their cancer.
And, you know, I mean, please correct me if I'm wrong, but pancreatic cancer, sometimes it's detected so far along that's one of the reasons why, you know, it leads to so many deaths. What can people do to maybe try and catch it early? And what can we let people know who maybe are dealing with this right now and want to know more about this vaccine?
Yeah, I think the first important thing is that there are treatment options. Yes, this disease does present aggressively, and I think in the context of seeing expertise, right here in Florida, Jupiter Medical Center is a center of excellence for pancreatic cancer, one of only 7 in the state. But to answer your question about knowing what to do, is knowing the symptoms, knowing your risk profile, because I think it's important to have those conversations with your doctor to see if in fact, and just to allude to some of those symptoms, it's usually non-specific, but low back pain, upper back pain, sometimes jaundice, yellowing of the skin, eyes, weight loss, those are alarm symptoms.
Runs in your family, is that
exactly.
one of them too? Okay.
So we do see about 10 to 15% of patients that have a family history for pancreas cancer. So ultimately those patients every patient with pancreas cancer should be referred to a certified genetic counselor to have that workup to see if there are any predispositions or actionable mutations.
Before we let you go, Doctor, talk to us a little bit about what's going on at Jupiter Medical Center. I know you briefly just touched upon that.
Yeah, so as of last year, Jupiter Medical Center was awarded as a high volume center, but more specifically a center of excellence by the National Pancreas Foundation. We typically approach pancreas cancer as a multidisciplinary team, so not only myself as a surgical oncologist, but medical oncology, radiation oncology, review the pathology, provide the necessary second opinions that I think are key to making this diagnosis. And Jupiter has really sort of pivoted to be able to offer next day appointments as a priority for
Wow.
patients with this diagnosis so that we can see patients immediately and at least start a plan for
Start
treatment.
the process,
Yeah.
exactly. Yeah, well, thank you so much for
course.
being here with us this
Yeah.
morning. So
Thank
great
you.
to see you again. And we have more information on our website, WPBF.com. Just go ahead and search pancreatic cancer. And this